Welcome. I'm Dr. Dean.
And I'm Venzel.
So we're here today to talk about another one of our topics that we try to avoid talking to people about. But we also know it's an important message. So the message is about the core. Mm-hmm. So there's a lot of core messaging out there. Mm-hmm. What is the core? What does it do? Why do we have it? How can core knowledge be integrated with activities and performance and sports, right? Mm-hmm. So we recorded this once and our heads were chopped off, and we're re-recording this. But it's good because we were a little too lively, I think. Yeah. Which is all right. We want to include everyone in the conversation. So the idea is that we sort of help our audience understand part of our journey, and the journey brought us to CXS system.
Exactly.
Right, and the CXS system is about understanding the root of, let's say, power or performance, not necessarily that more core activation amplifies the way you perform, but it optimizes. It becomes, let's say, even like critically specific.
Yeah.
Okay. So when we talk about the core in the trainings, we usually have all of the audience. We say, okay, hey, so first question is, what is the core? Where is it? What does it do?
Yeah.
And basically, my experience is there is no answer. Or they'll say, oh, it's somewhere here. It's sort of used, for heavy lifting, or it's definitely used in performance or activities. But when you kind of get down to the definition of it, like specifically, what do you hear?
Well, I hear, you usually hear the core as, in terms of the core, you hear rectus abdominis. So they think it's just the rectus, and they don't even think about the obliques. They don't think about the internal, external obliques, the serratus. They don't think about muscle groups that are more distal from your trunk, like your shoulder. Your shoulder can be a part of your core as well for stability.
Exactly. Yeah. So let's just try to pick it apart really quickly for you so that you can understand what we're getting at, why we're here today. So the idea is that the core, yes, it's somewhere in this area. And the idea, if you think about core, you can even think about like a balloon or a ball. And if you take that balloon or a ball and you kind of press it into the center of your body, we could say that balloon or that ball becomes like, the intestines, basically. It's the small and large intestines, right? And then the top of the ball is the diaphragmatic sort of covering, right? So we can say that's the top of the balloon. Yeah. And the pelvic floor is sort of the floor, bottom floor covering, right? And then the obliques are sort of the side covering, right? And then the back, we say, it's not really covering, is like the multifidus. And then there's this kind of story, you already brought it up, about rectus. Well, rectus is basically just, a trunk flexor. It really doesn't contribute functionally to the core. So if you think about the core as a ball, like a fluid ball, right? If you can compress side to side, top to bottom, front to back, you're going to increase the density of that fluid ball, and that becomes a stabilizing feature. Yeah. Right? So in and of itself, the core doesn't do outward power. It creates a solid foundation, more solid of a foundation. Okay? So we could say that the core, by definition, is the myofascial integrative center of the body.
Exactly.
It is the place in the body where forces are transmitted across the top to the bottom of the body, right? Front to back, left to right, right to left, and anterior to posterior, posterior to anterior. So all these vectors are kind of, right? But the problem is you can't transmit forces of power through the intestines, right? Yeah. But the whole middle of the body, besides the spine, is essentially just digestive organs.
Yeah.
So those forces have to be transmitted around the outside of that balloon. So the core really, if you want to understand it truly what it really is, the core in of itself doesn't produce outward power, it doesn't produce strength, but what it does is creates a foundation from which right, we call that the inner unit really, right? And then there's the outer unit. So the inner unit, that core stability, is directly related to primarily respiration, right? Because there's that big piece of the diaphragm, the respiratory diaphragm, that's on the crown, or called the roof, right? And then the obliques. And so those are also attached to the ribs.
Yeah.
So breathing in and breathing out, you can see you can
Inspire,
you really get a
expire,
compressive force on the inside. Now once that inner unit is really compressed, then we add the outer unit, which is to your point, which is the shoulder complex, hip complex.
Yep.
And those are those myofascial slings.
Yep.
Right? So tell me about slings.
So dealing with slings, it's connective tissue that runs across multiple joints and multiple muscle groups. And being able to address that motor pattern through the sling is what CoreX is all about. And that's why I kind of fell in love with CoreX. Yeah.
So that's right. So we're talking about connective tissues. We're talking about the integrated muscles that they're, right? So go ahead and stand up.
Okay.
And then so this is just a quick demonstration. This is rhythmic stabilization. Let's step back a little bit maybe here. So this is rhythmic stabilization, and it's a really great way to demonstrate to an athlete or to a patient what it feels like to truly recruit your core. Okay, so I know athletes and trainers, coaches, they all talk about outward forces, outward power, producing power, pushing, lifting, jumping, swimming, being faster, driving down, all those things. They think about the core and they think about producing power, but there's also accepting outside forces. Yeah. And then, so if I create an outside force on Venzel, he is going to then transmit that force across his body. Yeah. Of course, his whole upper body is open chain, the bottom is closed chain. So he's going to borrow some stability from the closed chain from the floor, okay? So rhythmic stabilization is a classic sort of a drill. So you're going to come into neutral. Yeah, so you can tell his feet are wider than shoulder width apart. His fingertips are pointing up. His fingers are lower than his shoulder. His gaze is athletic, ready, forward. Shoulders are pretty much towards the back. You can tell he's slightly pitched forward from the trunk. The legs are slightly bent. So he's got about 120 degrees at the elbow, the hip, and at the knee. Okay, so what I'm going to do is place my hands on his shoulder in the back and on his shoulder in the front. Now, if you do this with a patient or an athlete, make sure you don't smash their bicipital tendon in the groove here, because that can be a little painful. So what I do is I cup my hand like this instead of flat, just make a little dome so I can get over the delt. So what I'm going to do is I'm going to do a push-pull. So this is a push, this one's going to be a pull. And I'm going to rotate him. Okay, so he's going to anti-rotate right away. Pushing and pulling. Now you can feel that, right?
Yeah.
And where do you feel that?
Across the sling.
Right. So you feel it in your legs, your feet, your glutes, right? So then I'm going to release him and just have him stay in the center. So the cue is I'm going to put some force on you. Make sure you stay dead center, right in the center. So he's anti-rotating, but he's not, drastically turning his body. So I'm just going to do this. And then watch this. I'm going to quickly switch here, quickly switch here. Quickly switch. So he's going from rotation to rotation. Now he's not doing any movement. You don't see physical movement, but you can tell. Now I can already tell he's got like this heat coming off of him from this. This is work, right? So if I just hold that pattern, where do you feel this?
I feel it.
Chest, shoulders, lats,
quad, hamstring, my glute.
Right. So the idea here is that we're really turning on. Now I'm going to ask him to pull his belly in a little bit more to increase that core, that balloon stability base, right? And then what I want you to notice is he's got a little bit more kick He's got a little bit more power. Good, take a break. Yeah, this is a lot of work.
Yeah.
Yeah, so the idea is that the push-pull is going across those slings, those motor slings across the body. And so we're transmitting from here, right, from the upper body across to the lower body to ground force reaction or to into your base. So that's basically the description of the core. So obviously, if we said, what's a core exercise, we would hope any exercise, especially if it was sport specific, would integrate the core.
Exactly.
So you wouldn't just train, like some people say, today's leg day.
Yeah.
Right? There's not core day. Every day.
Every day should be core day.
Right.
Yeah.
Even if you're doing, a dumbbell bicep curl, there's a way to dial in your consciousness of, are you doing core compression? And then remember that, necessarily just making weights or making your work harder or heavier is not automatically going to involve your core more. It actually may reduce your core
stability and your core,
activation. Now notice in our example here with rhythmic stabilization, Venzel was doing absolutely nothing. He was just standing there. So then let's take this a step further. And I've just got a volleyball here. So he's going to come back into that core neutral position. And then I'm just going to have you turn this hand sideways. So I'm going to put this ball, open up your hand. So I'm going to put this ball here, right? Now I'm going to, so basically I'm going to be driving his body this way, and he is going to, from the trunk, not from his arm and not from his hand, not from his bicep or his shoulder, but through his core, he is going to anti-rotate into the ball, right? So we're holding. So I've got about, 5 or 10 pounds of pressure, I'm just going to guess, into the ball, right? So I'm going to give him a little more. I'm going to say it's about 20 pounds of pressure into the ball. And now he's starting to dial up his core a little bit more, drawing it in, dropping his shoulder blades down, activating the lats, activating your transversus, pelvic floor, diaphragmatic roof, okay? Now, he's going to hold that. Now, he's got some tension, right? You're full on into core neutral, right?
Yep.
You feel like you're 100% recruited? Yeah. So now what's going to happen is he's going to stay 100% recruited, 100% recruited, 100% recruited, but he's not doing any work. So this is a perfect example of doing absolutely no external visual work, right? No outside forces, but 100%, maybe an 110% core recruitment. So if I go in there, right, he's already in, take a big breath in, exhale, relax.
Woo! Man, wow, that's intense.
That's intense.
And I didn't move an inch.
Right, and you didn't move. So remember that, I'm just going to put it out there, it's possible that even the smallest little refined movement, right, think of curling.
Yeah.
Right? Think of curling. Curling is just that gentle, right? But they're
Slight
not
push.
just jelly, right? They're athletes.
Yeah.
And so they're getting into that shape, and then they have to stabilize in that really long, almost narrow stance, right? Out into that, and they're in neutral. They're training. I guarantee you, they're training core.
Yeah.
Okay, great. Well, I'm exhausted just from doing quick stabilization. I hope you enjoyed that, and please email us if you have any further questions. We're going to try to be on social medias absolutely as much as we can with our good message representing Correct System and preformanceCXS. Thank you so much, Dr. Dean.
Venzel, you guys have a good one.
Thank you.